My name is Denny Hansen, and this is my project for Population Health Nursing 8311 Epidemiology and Population Health Study on Sexually Transmitted Infections in the residents of Fulton County, Georgia. This will be a health assessments need type of project. In this project, sexually transmitted infections or sexually transmitted diseases were used interchangeably. However, they are technically different. Infection is when a pathogen is acquired from sexual acts that causes an actual infection, and then when that infection causes a disease state that's described, it is a sexually transmitted disease. However, when using this, we did use that pretty interchangeably, which most do. Over the last 20 years, throughout the world, throughout the country, the state of Georgia, and Fulton County, city of Atlanta, there's been a steady increase of STDs over the last 20 years. By age 25, half of all sexually people in the United States will have contracted an STI, and most of the new infections, over 50%, are in the same age group of 15 to 24. Georgia's near the top of the total infections reported in the country when you go by state. In Fulton County alone, there's nearly 1,000 cases per 100,000 of the population. Presented here is an epidemiological triangle on sexually transmitted infections with agent, host, and the environment. As you can see, the agents typical, as we were discussing in the last slide, age 15 to 24. Race, we'll discuss a little bit more later, but the large portion in Fulton County, new infections are African American. Immunocompromised are at more risk. Definitely someone that has one STI is more at risk for contracting another one, especially when you have one and then they contract HIVs. Risky behavior, drug users, religion practices such as not wanting to use condoms based on religion. Region, we're talking about the Fulton County. Your social or sexual network that you're in has much to do with contracting it. Definitely your beliefs in risky behavior that you do, the socioeconomic factors, access to healthcare, social pressure, low education are all part of the environment that make a vulnerable population more susceptible to contracting these diseases. And then different diseases are listed here that we'll be talking about. Target population was Fulton County, Georgia residents aged 15 to 24. This population age group, as we discussed before, is the most susceptible to contracting a new sexually transmitted infection. African Americans are at the top of that list. Things that have constantly come up in the literature review that show that these people are more vulnerable are risky sexual behaviors and their norms, psychological distress, and misconceptions of condoms, such as many people believe when questioned in surveys and in the literature said that they use condoms to prevent pregnancy, but did not have anything that they believed in that it could prevent any kind of sexually transmitted infection. And as we discussed, majority of cases in this age group were African Americans in Fulton County, Georgia. Presented here in Table 1 are the STD cases by residents, all except for congenital syphilis, age 15 to 24. Not wanting to leave congenital syphilis out, but this is one way that they rate all of the sexually transmitted infections because they are acquired from a person to person, not mother to fetus, which is extremely important. The congenital syphilis rate has also increased as these other ones have, and it is one of the causes of mortality in these diseases. Congenital syphilis is responsible for a large amount of stillbirths and deaths after being born. And as you can see here, from 2010 to 2020 in Fulton County, there has been almost an average, a pretty good increase throughout the years. There have been a few years where it went down, but then went back up. And definitely in the last 4 years, we've seen a pretty heavy incline. And now we're up, as of 2020, up to almost 8,000 cases just in Fulton County. Diagnosis is typically based off of either blood serum testing or swabbing, oral, vaginal, anal, or penile, depending on the type of disease that you're looking for. It's for the most part is pretty simple. Many antibody antigen screening tests such as HIV are available. Screening is based on age and sexual activity. Example would be gonorrhea and chlamydia. They recommend up to age 25 yearly for sexually active patients. And then HIV screening is recommended at least once in sexually active patients, but then could be as much as yearly or every 6 months or every 3 months based on how many partners we have, how risky the behaviors are, and how long they've been sexually active, and other contracted STIs. Prevention, the obvious main prevention is abstinence. Then condom uses in the literature comes up constantly with just misconceptions and how everything from religion to just people's own beliefs are causing that, even especially in Fulton County. Vaccinations for HPV and hepatitis. HPV vaccinations are definitely something that has increased, but is still not constantly brought up by providers, and many people, parents don't have the education about their children that they could get this and that this is something that can prevent cancer. So it's something that is definitely a need for the education to be there to get these patients, these children vaccinated for HPV. Diagnosis and treatment to prevent long-term complications and acquisition of new infections is also a prevention strategy, and then things like HIV PrEP as well. With treatment, it definitely depends on what we are trying to treat. Everything from HIVs to herpes simplex virus, some like that are not treatable at all. The biggest things in the literature that has changed recently, especially for APRNs, to understand is that the gonorrhea and chlamydia treatments have changed, which is some of the most common things that are treated in walk-in clinics or ERs. It used to be if you showed signs and symptoms of gonorrhea or chlamydia or tested positive for either, you would get 250 milligrams of IM Rocephin and then a gram of oral azithromycin right then and there. These recommendations have changed. They have increased the Rocephin to 500 milligrams IM. They don't immediately recommend doing the co-treatment unless chlamydia hasn't been ruled out. And then the 1 gram oral azithromycin has changed to 7 days of 100 milligrams twice a day, doxycycline due to resistance. However, the recommendations also show that if you believe the patient will not finish it, then to go ahead and give them the 1 gram, 1 dose of azithromycin, as this is better than them not taking anything. Descriptive epidemiology is the basis of looking at the person, place, and time of a certain disease occurring, and what this shows here is the area of Fulton County, the race, the time, similar to the previous one. This one's just broken down by race. It does show the large disparity with African Americans in this area that make up most of the cases in this area. Management challenges. Reluctance to get testing is something that is extremely common, and it's comes with the social stigma. People don't want to be found out that they have this, and so they just choose not to get tested and let it go. Access to healthcare in lower income areas and countries. Perfect examples of the third world and middle income, lower income countries just don't have the access to the treatments, then the screening. Different strategies, funding, marketing, education, lobbying government officials and the Board of Nursing, Board of Medicine to funnel money and education into these areas. A stat here that was staggering was just a recent Senate race spent $330 million on TV ads only. The thought there was what could be done with that $330 million and spent somewhere and actually make an actual change other than ads on TV for a Senate race. And that concludes this project, and then the rest of the slides will be references. Thank you very much for watching.